everyone. Welcome to the second cervical cancer awareness webinar within our series this month. Today, our speakers include Tamika Felder, Chief Visionary of Cervivor, and Karen Nakawala, Executive Director of Teal Sisters Foundation Zambia. If you can put all of your questions and comments in the chat or Q&A, we will get to them at the end of the presentation. And additionally, this session will be recorded and uploaded onto the AVAC website with PDF copies of our speaker slides. And with this, I turn it over to Tamika.
Well, thank you so much for having me. I'm happy to be here. And let me just say Happy New Year, but also Happy Cervical Cancer Awareness Month. It is a great time for us to all be here together and sharing and learning more about ways that we can protect each other. And I'm so happy to be here with you all this morning, this afternoon, wherever it is that you are joining us from. So let me share my screen. And excuse my messy, I tried to fix it before I shared it. Well, hello, I am Tamika Felder, the Chief Visionary of Cervivor. Very happy to be here with you all. And, prior to getting diagnosed with cervical cancer, I was just a girl in the United States of America growing up in cervical cancer, growing up without knowing anything about cervical cancer and just thinking about what my hopes and dreams and wishes were. And that was to work in media. And I found this picture, I don't know how many years ago, looking through old family albums. And I just said, this was me then, and this is me now. So it seemingly a lot hasn't changed, but if you look at that space between those photos, a lot has changed for that little girl with the microphone in her hand to the grown woman that now speaks and talks about cervical cancer. And so, diagnosed with cervical cancer, there is never a right time to be diagnosed with any cancer. And for me, I was diagnosed with cervical cancer at 25. I was working as a television producer in Washington, D.C., and my life was ahead of me. I had all my hopes and wishes and dreams, the things that I had worked so hard for, the things that I talked about in my diary, they were coming true. And then cancer came in and just changed everything. And so what happened was I was diagnosed with stage 2B cervical cancer, and I endured a radical hysterectomy followed by chemotherapy, radiation therapy. I lost my fertility. I deal with secondary post-cancer issues. Sometimes I feel like I shouldn't even bring up the secondary post-cancer issues because overall I feel so blessed to still be here because I know that unlike what some people think, cervical cancer is not an easy cancer, and I'm lucky to have made it through the other side. But the reality is that all of these things, the radical hysterectomy, the chemotherapy, the radiation therapy, the loss of fertility, secondary post-cancer issues, are things that I'm reminded about every day of what I went through, but I made it. It's been a journey, but that journey has also led me to what I believe is my purpose in life. And it's what Dr. Heather Palmer, a psychotherapist, calls cancer is a gift wrapped in barbed wire. It's a gift because if you can find your purpose on the other side, if you can find how resilient you are on the other side, it's a gift. But that gift isn't wrapped in pretty shiny paper. It's wrapped in barbed wire because it leaves you tattered and scarred. For me, that barbed wire gift helped me find my why. And my why is the organization that I created, Cervivor. When I was first diagnosed, I didn't know where to go. And to be fully transparent, I was diagnosed in 2001. So we didn't have Zooms and these webinars like this. We had, you know, we didn't have social media. So it was going to the library, trying to find an in-person support group. I had AOL email, which I still have. And trying to find someone else, not just in the US, but in the world who had cervical cancer, because I couldn't be alone. And I couldn't find that. I would find all other types of cancers, but not cervical cancer survivors. And I started with what I didn't have. And I created a way for people to come together, not hide our faces, to share our stories. And building, it was truly building what I wish I needed when I heard those words, "you have cervical cancer." So that meant I had to share, and I had to pull off the Band-Aid and share what happened to me, how it made me feel, how it impacted me, what I wanted people to know, and why it would help them, right? Why should people come and talk about this cancer that is associated with the human papillomavirus, that carries the stigma, and to some, to many, a burden? Why would they want to share? And for me, I know that building this organization is what healed me. And so I've gone on to do a lot of amazing things. I've shared my story in very small places. I've shared my story in big places. But probably what is most special to me is when I share my story and someone sends me a text message or they call me and they say, my neighbor, my daughter, my cousin, my coworker, someone was diagnosed with cervical cancer, and they know that they can come to me, they can connect with um my organization. We can connect them. You'll hear from our next speaker, Karen. We'll connect them to Karen's organization, depending on where they are in the world. And we are all united globally to end cervical cancer. And as a patient, when I was first diagnosed, I couldn't see any of this. This wasn't anything that I could see. I only knew that I didn't want to die, that I still wanted to live, that there are still things that I wanted to experience in life. And then I wanted to know, what color is my ribbon? Where's my walk? Where's the ribbons in grocery stores and all of this for cervical cancer? And I started getting involved and I started meeting people and being invited to guideline panels and learning more about the science and learning the data. And I connected the dots. Here's what we know about cervical cancer. Here's what we can do about cervical cancer. Here's what clinicians, researchers, NGOs, community organizers, everyone is doing about cervical cancer. But where are the patients telling their stories? Unlike other disease sites, we didn't have the masses of patients telling their stories. I wanted patients to know that we can eliminate cervical cancer and your voice can change the world, but you have to share it. And so through Cervivor, we provide exceptional support and empowerment because at the end, we want people to know that they are never alone. You may feel alone in your part of the world. You may feel alone that only this is happening to you, but we let them know through sharing real life stories and having a vast majority of programming and support for them to know that they're not alone. We do patient advocacy training through our survivor schools. And it's probably what I am truly most proud of at the end of the day, because these people diagnosed with cervical cancer are making their survivorship count. They are knowing that their story is helping spread awareness, it is saving lives, and it is changing people so that we can increase vaccination. We have survivor ambassadors around the world. Anna Ogo, who also lives in Seattle in the US, but also is a citizen of Japan and does many things in Japan. And Carla Chavez, who is in Honduras and helps co-lead our Survivor Espanol, Millicent and Sally, who are in Kenya. We have Morgan, our community engagement liaison, who runs most of our programs here and keeps our 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 community together and empowered. And Kimberly Williams, our Chief Diversity, Equity, and Inclusion Officer. These are all people who are cervical cancer survivors, thrivers. They were patients and they were a part of our community. I tapped on them. They became whether employees or volunteers and decided to, I see the vision, I can make the survivorship count. Karen North, who is Survivor Pride and really getting our LGBTQIA plus initiatives off of the ground for us, because we have made a commitment. We've made a commitment not only to make sure that people get screened and they don't fall through the cracks, but we've made a commitment that we will help individuals from various backgrounds who feel undervalued. We want them to be representative. We want them to know that we hear you, we are you, and we can do all of this together. And we are partners in purpose. We have partners, and we know that our partners pour into us, but we also pour into them. Dr. Noah Brewer is one of the people who said that, we gave the data, but we didn't tell the story. And so that clicked with me. And so we let the scientists do all the things that they do because they're good at it. But we as patient advocates, we tell the story and we bring the data to life. And we're proud of all our partners around the world. And we know that our stories create change. And patients are brave. They are brave and they are telling their stories. And we do it by creating safe spaces to share stories. So thank you all today for creating a safe space for Karen and I to share our stories. We engage with people around the world, we empower them, and we let them know that together we can make a difference wherever we are. We also do that by remembering, because sadly, people do die of cervical cancer. And we want to honor those lives that have succumbed to this, what we know now as a preventable disease. And we have the tools in our toolbox to eliminate it. And this is a very brief highlight of my story, my work, my passion. Feel free to connect with the organization. Feel free to connect with me. Join us. January Cervical Cancer Awareness Month is still going strong, and we still have many activities. It is not too late to get involved, and we hope you will join us. We have a summit in New York that's happening. If you can't be in New York in person, you can be there virtually. Join us for that. All of these, if you missed the QR code, you can go to survivor.org, go to our events page. And you can also keep in touch with me directly. I'm here as well. I wear many hats that I'm so proud of. Cancer robbed me of my fertility, but through my amazing survivor community, my story has a happy ending, and I get to be a mom through uh, embryo donation and surrogacy. They're a cervical cancer survivor in our community. She and her husband donated their unused embryos to me and my husband, and now I have a baby boy. So what cancer took from me, I got it all back and even more. And this is our big, happy, modern family. I thank you all so, so very much for allowing me to share with you all today. And let's commit to join together to make sure that women get screened of cervical cancer, that we increase vaccinations so future generations will not have to deal with cervical cancer or any other HPV-related cancers. Thank you so much.
Thank you so much, Tamika. That story, your story, was just so incredible and inspiring, and I really appreciate your time today. A reminder for our guests this morning is that if you have questions for Tamika or for Karen, you can put them in the chat. And someone has been kind enough to share Karen's slides. And so with this, I hand the presentation over to Karen.
Hi, hi, Alison. Hello, everyone. And hello, Tamika. Thank you so much. I managed to do this, but I'm pretending to be tech savvy. So again, I just want to say thank you for the opportunity. And every time I get an opportunity such as this one, I always want to tell how I met Tamika. I was diagnosed with cervical cancer stage 1-2B in 2019. And at the time, I think it just felt like I still remember going back that day where it just felt like I was in an ice cube. And if you see this picture that I put here, please excuse my my slides. I didn't get a chance to clean them up because this morning I had a bit of a scare, but I'm just glad to be here. So what you see there is actually the day that I got diagnosed. And I always love to show this picture because if you look at it, it doesn't show that this person has cervical cancer. It doesn't show, I didn't have any symptoms at all. And on this day, ironically, I was actually a master of ceremonies at the official opening of one of the biggest private hospitals that we have. And in the audience was the husband to my gynecologist. And he comes to me and he says, Karen, you haven't been to visit us at the clinic. And I'm like, why should I come to visit you? I'm not sick. You know, I only come to the clinic when I'm not well. And then he says, no, but you have to come for your cervical cancer screening. You keep saying you will come. And I'm like, okay, you know what? One day I will come. And that day he said, Karen, I've made a booking for you. You have to come for your screening. And he kept calling me. And so in the afternoon, I decided, you know what? After I finished my work, let me go and do this thing to get this man off my back. And so I went and chit-chatted with my doctor. And the minute she inserted the speculum, she looks at me and I could see there was this look on her face because we're friends, you know, and I think she failed to hide it. And she asked me if I was in pain. And I told her no. And she says, well, because you're bleeding on contacts. Have you been okay? I said, I have been fine. Sometimes I have a bit of a backache. But, you know, it goes off with a massage, it goes off with a bit of paracetamol and nothing major. And my life goes on. As you can see, I used to love wearing my high heels, you know, and that was my life. And I remember when the news finally hit me, I think this was like a week later, I was asked to go in again after we did a pap smear. I didn't want to go into the clinic. And so I asked her to just tell me on the phone. And she said, no, you have to come in. So, okay. At 7 p.m. in the evening, I drove to her office. And she told me, she says, you know what? This is cervical cancer. And I can't do anything beyond this point because she's a private practitioner. I want you to go to the cancer hospital. I had never, ever been to a cancer hospital. Everybody that I knew that had, you know, had cancer with friends, and most of the time you hear about them dying much later, you know, after they've been in the hospital. So I had never, ever been. I had heard about it. And that day I walked those corridors and they were so cold. They were so cold. I felt like I was in an ice cube. It was an out-of-body experience. I had no idea what was happening to me. And so after seeing doctors, you know, they did a biopsy, they did whatever tests they could. They told me you had stage cancer 2B. That was the initial diagnosis. So I had to go through other tests. And so that week, and I kept it to myself. I never told anybody because suddenly I started reading about it and I realized there was so much stigma attached to it. And because of my standing then, I was literally running the fashion space in the country. I was the founder for the Zambia Fashion Week and the director. And so anything to do with fashion was really me. When you talk about fashion, the first person they'll point you to is Karen. And I was on radio, and that same time I was actually shooting a television show with a friend of mine that I was presenting. And I think my whole world just turned upside down. And the first thing I wanted to do was to find somebody who had gone through the experience, and I couldn't. And so I turned to social media, I turned to Facebook, and I just typed in cervical cancer survivor. And the first group that came up was Cervivor. And I started reading stories. I started reading about Tamika, and I thought to myself, okay, I think at this point, I started believing something could be done and that I wasn't going to die, because the first thing I thought about was I was going to die and I was going to leave my 2 children. I have 2 beautiful girls, and I wasn't married at the time. I had a partner. And so I couldn't tell him because I was scared that he would go, he would run if I told him. I was scared what my kids would go through if I told they told their friends, and so I kept that to myself. And I found life and I found hope in Survivor. And at that point, I never even thought I was going to do anything in that space. So I think through Survivor, I got to a point of acceptance. And lucky for me, between diagnosis and start of treatment was less than 3 weeks, which I think in this time and age, I consider myself really lucky because I've got women right now in this country that are waiting 2 years to go on treatment because we're struggling with radiation. And even when we had the radiation, there's so many cancer cases, and I think we had 3 radiation machines to go round. So I was lucky. I never got an opportunity to pity party myself, but I think I'm just one of the very few that were as lucky as I got. And so I started my treatment journey immediately, and I had radiation, I had chemotherapy, and it ended with brachytherapy. And so during my journey, it was actually in the second week of my treatment that I opened up to my partner, who was kind enough, to stay with me and walk the journey with me. And the first thing he said when I told him was, "So you've been hiding this from me because you thought I'm going to run?" And I was like, "Yes." And then he says, "No, honey, we're going to do this together." And that story for me is so important because through my treatment journey, I met women who lost their husbands because of cancer. I met women who lost their jobs. I met women who practically just estranged from their families. But a couple of sad stories. When we're doing brachytherapy, there was one lady. So I met her on the first day of my brachy, and on the second day of brachy, she comes in walking like she's got a plank between her legs, like she was literally struggling. So I asked her, I said, what is wrong? And then she opened up, she said, "You know what? My husband yesterday says to me that you've denied me sex for the last month or so that you've been on treatment, and if you don't sleep with me today, I'm going to divorce you." And she had no choice. She couldn't lose the husband. So this man ended up sleeping with her, not knowing what he was doing to her, the damage that he was causing to her. And so the next day she came, she could barely walk. The second story was on the third brachy session, there was one lady, because we formed a sisterhood, there was one lady who didn't show up. And so I asked one person who was close to her, I asked, "Where is she?" And she says, she can't come today because when she went home the day before, after her brachy, she found that her husband had moved her stuff from their bedroom and put it in a spare bedroom with the kids. And that night he brought another woman in the house because according to him, she was no longer woman enough for him and she wasn't good enough for him. And so she decided there was no point in her continuing this treatment because of what the husband had done. And we managed to rally around with the other ladies. We went to see her the next day and we managed to convince her to get back to treatment. And fortunately for her, she managed to finish treatment and started a business, and that's how she left the husband for good. And so these are just some of the stories that I came across during my treatment. And so I started speaking to the women and asking them if they knew what cervical cancer was. And most of them told me they had no idea what it was. Most of them were saying it's witchcraft. In Africa, witchcraft is a big thing. And they believed that it was the husband's girlfriend who did that to them, and they started bleeding and they couldn't stop bleeding. Another lady who was quite elderly in her 60s says to me, "My daughter said it was cancer, so I'm going through this treatment. I don't even know why she's bothering because the bleeding has stopped. She should have just left me sit at home." And I'm thinking it's because of the treatment that is why the bleeding has stopped. But she was convinced it wasn't cancer, it was witchcraft. And so fast forward, I finished my treatment and I think to myself, it took me a while to actually open up to anybody else apart from my partner and some very close friends. And in the meantime, I continued shooting my TV program, and I finished shooting that TV program in the 3rd week of my treatment. I even went for the premiere of the show, and that day I had come back from chemo and radiation. And so I went back home thinking to myself, I'm actually stigmatizing myself, by keeping quiet, by not saying anything. But even then, I think I wasn't convinced that I should say anything about it. It was only in January that one of my doctors, her name is Dr. Sharon Kapambwe, some of you may know her, called me up and said, Karen, you need to do something about this. You have the platform, you have the voice, you have the means, you need to talk. Our women are dying every single day. And I said to her, look, if I say I've been going through cancer treatment, they're going to stigmatize me. And she said, well, somebody has to do it, and who better than you to do it? And so I decided to start a Facebook page. And on that page, I thought I was going to get 50 to 100 women who want to talk about it, because it's taboo to discuss such things, to discuss anything below the belt in Africa, to discuss sexuality, anything to do with sexuality. But lo and behold, by the end of that week, we had over 10,000 subscribers to the page, and very actively too, wanting to know about cancer, wanting to know about where they can go for screening. By the end of the month, we had over 100,000 women. And I remember getting a call from the hospital telling me, Karen, you're putting us in trouble. We've actually run out of consumables for screening that we had for the entire year. And they went through it in the first quarter. And that's because women started going for screening in groups. From the offices, they'll go and get screened. And in that year, I remember Zambia became the top country when it comes to screening in Africa out of 20 countries. And I think at that time, I still didn't know that, the power. I still didn't know the power of the lived experience. And one day I was invited, because of Facebook page, the First Lady then invited me to go and speak at an event. It was a high-level event. It was WHO. There were all these partners. There was UICC. And I went, and I think everybody was shocked that they called this cancer survivor and people didn't know. And the next day, that picture was in the paper. And the whole world was like, everybody was like, what happened? You don't look like you had cancer. Others even went to the extent of saying, no, she didn't have cancer. She's just kidding. They're just using her, to spread the message. And I think it was at that point, I remember reading a story, I can't remember her name, but on Survivor, about how she started speaking out about her condition and got so many people to actually get screened. And I started reading so many other stories on Survivor. I started reading about Tamika's story and how she ended up with Survivor. So I always tell her she's the reason why I started Still Sisters, because I realized there was nothing in Africa, that was looking at cervical cancer like from a patient's perspective. There were other organizations that are led by wonderful people that are just sympathizers, and they're interested, or maybe they were caregivers. And so I decided to register the foundation now and move away from Facebook, because I also realized that the need was actually out there and not on social media. We have so many people out there that cannot afford social media. And that is how I started Facebook. And so I'm going to take you back into history a little bit. So from time immemorial, we have learned and heard stories about leaders who fought for the freedom that most of us enjoy. We have heard of sacrifices made by the likes of Mr. Martin Luther King, and just the other day was Martin Luther King Day. And this is one of my favorite quotes. He says, the time is always right to do what is right. And I think the time for me then was right. Like, it took me so many months to get to a point of starting to use my voice. And even then, I didn't realize how much power that voice had. So I always look at Dr. Martin Luther King as one of those people that actually inspired me. And then we've got Dr. Mandela, who says, "It is in your hands to make a better world for all who live in it." And I always tell my fellow survivors that it couldn't have been said any better, and that it is up to us to use our voices. And the last one is Mahatma Gandhi, who said, "You must be the change that you wish to see in the world." And I think that's what Tamika, myself, and all the other survivors that are doing something in this space chose to do. We chose to be the change. And so imagine, you must be wondering why I'm taking you back into history. And the reason is that all of the names that I have mentioned, plus others, plenty others, had one thing in common. They believed in a cause. They believed in freedom for their people, and they fought until it was attained. So let us for a minute just imagine what would have happened had they not spoken up, had they not used their voices and not stood for what they believed in. Even in the most difficult of circumstances that they had, we would not be a free people that we are today. And so as a cervical cancer survivor, these men and women from the past remind me about the importance of my voice and the power of my lived experience and the role that our voices play in the elimination of cervical cancer. In the last 6 months, I have been invited to speak at several forums, and all of these were focusing on the meaningful engagement of people living with cancer and the need for them to be included in policy making, because they have realized that conversations about cervical cancer are not complete without the people who are qualified by experience. Survivors like myself and Tamika know all too well what a cervical cancer diagnosis does to a person, especially a cancer that is heavily shrouded in stigma, myths, and misconceptions like cervical cancer. This is a cancer that takes away so much from you. First, as a woman, we heard about how it took away the fertility from Tamika. Then, as a human being, it strips women of their dignity and integrity. Life is no longer the same after a cervical diagnosis. The embarrassing symptoms, such as continuous bleeding, sometimes the smelly discharge that women go through, and others are enough to just break even the strongest of people. And the anguish of not knowing whether you will live to see your children grow, the pain of watching your sisters die, some with no hope of treatment in sight, can be too much to bear for anyone. It is for this reason and many other reasons that we have these women on this platform today who have vowed to do whatever it takes to make sure that no woman goes through what they went through, and that their girl child will not be subjected to the torture of a cervical cancer diagnosis. I earlier spoke about the people that fought for our freedom, and I liken them to these survivors, these women that are ready to fight for the elimination of cervical cancer. And all they ask for and need is to be equipped as agents of change in our communities and beyond, because this fight cannot be won without their valuable input. And I speak from a place of pain, a place of love and concern at the numbers of women that are dying from a preventable cancer. Women who are in their prime and contributing to the growth of not only their communities, but the countries at large. And I speak from a point of sadness when I look at all the children that are orphaned unnecessarily and left to fend for themselves. But I also speak from a point and place of pride when I look at brave women like Tamika that are here today, ready to take the bull by its horn and declare war on cervical cancer and saying enough is enough. And I speak with so much admiration and love when I see how they put aside their pain, the horrible effects, the treatment, choosing to save the world one woman at a time. And also to save our young girls. So I have since used my voice with Teal Sisters Foundation to advocate for equitable access to cancer health services at both local and international levels. And I have been privileged to partner with organizations such as the World Health Organization, the Commonwealth, who appointed me to sit on the task force on cervical cancer elimination in the Commonwealth. I beg your pardon. The George Bush Foundation, the Bill Gates Foundation, who helped me lead over 70 survivors, caregivers, and allies to Botswana to have honest conversations with each other and chart the way forward. you have no idea how much power you get in a room that is full of people with a lived experience. And how I had wished that we had a lot more people to witness that. But we had to protect the women, and we had to create a safe space for them, because some of them had come from places where they can't even tell their families or the communities that they have cervical cancer. So I have used newspapers to talk about cervical cancer. I have had so many speaking engagements where I've had the opportunity to speak into policy. And also, I still use my radio program. I use that a lot. And I remember the first time I told my boss I wanted to talk about cervical cancer, he was livid. He's like, Karen, but cervical cancer means you have to talk about sex. I'm like, yes, I have to talk about sex. I have to talk about the vagina. I have to talk about cervix. And he says, but how can you freely talk about that? You know, we're going to get into trouble. I said, look, if we're going to get anywhere, we have to be honest with ourselves. We have to be blunt with the truth. I'm not going to call a vagina an arm just so that I can sound correct. You know, we have to call it what it is. And after my first show, he came to me and said, you have no idea how many people listened to that. And they actually want you to talk about cervical cancer more. And so I use that platform, especially now that it's Cervical Cancer Awareness Month. I do a lot of awareness on radio. Unfortunately for us, we do a lot of community engagement where we go and organize screening engagements in the communities. But for now, some of you may have heard, or maybe not, but we have cholera pandemic. So any large gatherings are not permitted at the moment. So we have to put that off to until everything is clear. But we still continue because we do the screening engagements throughout the year. And then as Teal Sisters, what we have done is we decided to go to the source. We decided to go to the cancer hospital. And after we applied for, we had initially applied for a table in the reception. They gave us a space outside for us to host Survivor clinics, workshops, and also to offer counseling, peer-to-peer counseling. And so I'd like to urge my fellow women out there that have gone through cervical cancer to say, you know what, there's power in your voice. If there's any group of people that can help bring meaningful change towards the elimination strategy, it is the survivors, because we have the ability to change people's mindsets through our powerful stories. Your voice is golden, and it needs to be heard wherever it is that you are. In 10, 20 years from now, your grandchildren will be saying, my mother was part of the movement that eliminated cervical cancer. And so I'd like to thank you for this platform. Thank you for the opportunity to speak to women about it. And thank you, especially that I get to connect again with Tamika. I always call her my lifesaver. And she probably thinks it's a joke, but she is really my lifesaver. So thank you so very much. And thank you, Alison, for doing this. I thank you.
Thank you so much, Karen. I think another incredible and moving story. And so with these two presentations, we're going to move into the Q&A session of this. And I'm going to give you a second to stop sharing. Yes. So Tamika and Karen, we will spotlight you. But I think one of the first questions is really thinking about something that you brought up, Karen, in how HPV is one of the leading causes of cervical cancer. And HPV is a sexually transmitted infection. And how do we have these conversations about STIs and sex and the vagina when a lot of people view this as uncomfortable or taboo? What are ways in which we can really overcome this?
I think we need to make cervical cancer part of our daily discussions, part of the daily conversations that we have. I don't see why we cannot discuss that when we're sitting at dinner with our families and discussing, because it starts from there. If I'm able to convince my husband, oh, by the way, I got married last year. I forgot to say.
Congratulations.
So if we can start this conversation, thank you. If we can start these conversations going wherever we have an opportunity. And I think I showed people, you know what, at the end of the day, it's just a body part, really. I don't see why it should be taboo. And I think that is why we have a lot of, for instance, where I'm coming from, we have pregnancies in girls as young as 10, as young as 11. By the time she's 20, she's got 3, she's got 4. And already she's a candidate to cervical cancer. And if we regularize these discussions about cervical cancer, about our sexuality, we are empowering our young girls, we're empowering our women, and they'll be better able to take care of their health. And the more we empower them, they'll go out there and empower others, they'll empower their partners, they'll empower their friends in schools until it's not a taboo to discuss sex anymore. Because I don't see why now that that should be a problem, especially in this day and age. It's sad that we let our children get this information on social media. They get this information from peers, and most of the time it will not be the right information, or it will not be communicated to them in the right way, or it will be a bit too late, you know, when they receive it. So I think we need to normalize having these conversations and just being honest, speaking to the truth about what it is, how it comes about. I think we're going to get somewhere.
And Tamika, did you have any thoughts on this question?
Yeah, I really do agree with Karen. I just think that we have to normalize these conversations. We're doing a good job, but we can always do better. We can make sure that our counterparts in breast cancer and colorectal cancer across the board are also normalizing it, right? What I've noticed is with cervical cancer, we focus on cervical cancer, we focus on HPV, but we also do talk about other cancers and taking care of the whole body. And so we need to make sure that others are doing that as well when they're focus maybe breast cancer, that they're also talking about cervical cancer. And so I want to make sure that people know that we're all a part of this and we all contribute to the elimination of cervical cancer. And let's just stop for a moment and just talk about how amazing that is, right? I remember when I first came into this space, there was no elimination discussion. It was people should not be dying of cervical cancer. Young women, women in general, should not be robbed of their fertility. And there has been a war on cancer for as long as I can remember. My father sadly died of colon cancer the day before my 17th birthday. We've made advancements, but none like screening and the vaccine for HPV to eliminate HPV related cancers. Everyone should be talking about this. Everyone should be on board with this, because why wouldn't we want to eliminate a cancer?
Thank you. I
Welcome.
want to add to all of our attendees that I did not know Tamika and Karen knew each other so well when we planned this webinar. So this was completely by coincidence and a network of people recommending both Tamika and Karen as amazing speakers, which they were.
Thank you.
So I just want to point that out. And I think, too, as we sit here on the screen, I feel incredibly honored to be part of a conversation with two women who look like me. I think it is incredibly rare for me to be on a webinar and see 3 Black women on the screen. And I also want to acknowledge how Black women, especially in the US, are disproportionately impacted by cervical cancer rates. We see them being diagnosed at later stages with higher grades, and this can be really impactful to a community. And so with the two of you on our panel today, I really ask, how is it that we can support Black women? How is it that we can really promote Black women health so that we don't see these rates and these disparities continue?
So for me, in the US, I will be very transparent that even though I'm a Black woman leading the organization, I struggled for many years with Black women feeling safe enough and comfortable enough to share their stories. The tide has changed. And I wish you all could hear from Kimberly Williams, who is, she's listening in, but she's our Chief Diversity, Equity, and Inclusion Officer. And she came into that role, but she was someone who was kind of lurking in the background and listening and not really participating like how I would think, how she participates now. But we would get people, they would share their stories, but they wouldn't activate, I would say, on a level that Karen and I do. And that's what I've been wanting, but now we're there. Now we're there, and we've created that safe space. They know the importance of sharing their stories. We hosted an event this past spring in DC. We're hosting another one this coming spring. We are making sure that those voices are not only amplified, but they are seen and they know that we're giving the safe spaces and also recommending them when there are opportunities for them to share. Because we've got to close the gap. We've got to close those disparity gaps.
Absolutely. I think it's like I said earlier, it's important for us to normalize this conversation. So one of the things that we do is we try to bring women together and just have these honest conversations. You try to make them take ownership of their sexuality. And the only way you can do that is include them in the conversations as you go. And also try to empower as many women, as Tamika has said. Not everybody is as privileged as she is or as I am to be able to have such platforms. But I'd like to believe that through our voices, we carry everyone else along. Because we can't have 100 women all speak at the same time. So we carry everyone else along, and that way we make them feel they're part of the journey. So every time that we get an opportunity, we try to have as many women as possible be a part of this, and also encourage them to go out into their communities to be agents of change. They go into their workspaces and they'll come back and say, oh, Karen actually spoke to my boss and she agreed that we should have a screening for the entire staff. And so for me, that is, a few women that are saved, and also when you go into these villages where they don't have the opportunity to be on social media, they can't even afford bundles. I think it's very important also to sort of just be as inclusive as you can. I always say, I shouldn't die because of my geographical location. I shouldn't die because I'm in a place that doesn't have so much, in terms of health services. I mean, for instance, we know that in Africa, many countries are struggling to actually implement the elimination strategy 90-70-90, especially when it comes to the treatment side. Most countries do not have the treatment. And so when you go out and you start talking prevention, you're not just you're actually talking to the larger group of women who are not affected yet by cervical cancer. So we've tried by all means to be as inclusive as we can so that they feel they're part of this journey and they'll go out there and do something. So inclusiveness, I think, is really important.
And we've had a couple of questions in our Q&A that I know, Tamika, you've already so graciously answered a little bit, but I do want to give space for you guys to discuss them virtually as well. So we have one person who said, many African programs are focusing on vaccination over screening. What are your reactions to this?
Mine simply is, yes, vaccination is key, but screening is also crucially important. And that was one of my issues with vaccination, is that screening got lost in the shuffle of that. And we know that we are generations removed from elimination. So we still need to be talking about screening. And I believe that there is space for us to talk about both and why both are critical to the cervical cancer awareness and prevention.
Just to add on that, the HPV is our first line of defense. And if we're not going to prioritize HPV, it's as good as us. We've got a tap that is running, and we've got a mop, and we're busy wiping the water off the floor, but the tap is still running. So we need to close that tap at the source. And once we close that tap, it's going to be easier for us now to mop the water off the floor. And so that tap is the HPV vaccine. We need to make sure that our girls are vaccinated. I just told you that in most countries in Africa, we don't have treatment. So the best we can do is protect the young girls so that they don't have to stress about where to get treatment when they are older. 19 out of 20 countries with the highest burden of disease is in Africa, and my country is the third one. And so this year, actually, our efforts are on HPV. Yes, we'll still talk about screening, but we feel we need to make sure that our girls are protected, because that is the best prevention we can ever give them, you know. And even when they go to screen later, I'm sure that the chances of them catching having cervical cancer will be very slim. And so, yeah, the bottom line is the HPV is our first line of defense.
And we had another question on how do you involve men in survivor conversations, because they are key.
I responded that all men have someone to love in their lives. And whether it's a mother, a sister, a favorite coworker, a nanny, whomever in their life that they loved. And that's how the conversation should start, because they all have someone that they love. We have a program that Kimberly Williams, it was her brainchild, Screen for Me. And I just loved it. I remember having something similar years ago. And I think it was Because You Love Me or something like that. But when Kimberly brought this to me, I thought, how powerful is that? We share our stories and we say, Screen for Me. That's a great way also to get men to say, I'm your loved one. I care about you. You need to screen for me so that you're still here with me, or however you want to use it. And it's become kind of like a way to get a conversation started. And so I really do like that, but always open. And I want to thank everyone in the chat who's sharing. For some reason, I can't respond to at everyone in the chat. But I really appreciate you all being a part of this conversation as well.
I think it's very important to have men in the conversation, because we cannot win this fight without them. They need to know that they are as involved as we are. I told you earlier about how I was scared of telling my boyfriend then that I had cervical cancer, because I had no idea how much he knew about it. And after I told him and we started walking this journey together, he literally made sure that he was at every appointment that I had. Whenever I needed to see the doctor for something, he made sure that he was there. So he understood. And I know that people would, were like, but why are you still going out with Karen? She's going to die, she's going to die anytime soon. She's got cancer. And when a few years after my treatment, he proposed, I think everybody was in shock, like, how'd you marry somebody who's got cancer? And so it's such things. When they see him, I've had men go to him and say, you know what? My wife was diagnosed with cancer, cervical cancer, and I thought I was going to lose her. But when I saw what you did for Karen, I realized that I had to be there for her in order for her to win this journey. We had to work together. So it's very important that men support, like Tamika says, they support their loved ones, they support their wives. And that is why what we have done, in order for us to include them, we've actually decided to do integrated servicing. So when we go for screening engagement, we just don't do cervical cancer. We do prostate cancer as well. We do breast cancer as well. And where we can, we do the HPV vaccination as well. So it's a whole family affair. And from there, it will trickle down to the community. It will trickle down to the leaders, to the churches, and most of the preachers we have are men. So if a man can stand up on the pulpit and tell the women, you need to go for screening, I think that is our job done. So we need everybody in these conversations. Yes, it's us that it affects. I was complaining to Tamika when we met in America about the side effects, how I'm not able to wear my high heels and things like that. But that it affects me as a woman. But we need the men to be part of the journey so they understand. Even Now he knows that when he's buying me a pair of shoes, he has to buy me one with, with a lower inch than before. So you have to walk the journey together with the entire family. You don't leave anyone behind. Otherwise, it's a fight. We women alone cannot win. We need everybody on board.
Mhm.
Thank you. And then our last question for today, we had someone say, I was so struck by both of these stories, particularly Tamika talking about how when she was diagnosed, there were no resources out there for her, but that a lot has changed since then. What concrete things can advocates do to strengthen the fight against cervical cancer?
Eliminate stigma, normalize these conversations. We have an issue with talking about sex. And this, for me, isn't just about the stigma. When we don't talk about cervical cancer, when we don't talk about HPV, someone dies. Someone can potentially die. Yes. Tira, one of our survivors, said silent no more in 2024. That's one of our themes for this CCAM. And that's what it is. It's empowering advocates to boldly share their stories. And for me, I remember when I started, we could barely get 6 people to publicly share their stories. And I want to give a shout out to all the survivor ambassadors that I see on this and in the chat. And anyone who's sharing their stories, we thank you. Anyone who support, you're a supporter because you're here with us today. But literally making sure that they know their stories can absolutely change someone's mind about vaccines. Their stories can save lives.
Absolutely. Tamika, I remember I was invited to Nigeria last year, and it was a big broadcasting conference, African Union of Broadcasters. And they said, Karen, would like you to come and speak about cervical cancer. And I was like, are you telling me you don't have survivors in Nigeria that can speak about cervical cancer? And I was told, you know what? It's very difficult in this community. And women are scared. And I was like, okay, so won't anything happen to me if I come up there and I start saying, oh, I'm a cervical cancer survivor? And he says, you know what? Somebody needs to do it. And I got there, and I was there for like 3 days, and people didn't know what I was there to do. And then on the last day, I had to speak. I went up there and I said, I am a cervical cancer survivor. The room, I think I've never had such a reaction to my story before, because the ones who stood up first were the men. I had men walk up to me saying, my wife died of cervical cancer, and up until now, the family doesn't know that she had cervical cancer. And he said, thank you for your voice, and I'm going to start something in her name. Can you please help me get these women out? And so what he did was, through empowering me, through asking me to go and speak, he started empowering the women in the community. And as Tamika said, all we need is for these women to be equipped. We need all these women to go out there and be agents of change. And they can only do that with the support of everyone. So like what you've done, Alison, today, you've created this safe space for us to speak, for us to be able to share. You've given us a seat at your table for us to be able to tell our stories. And that is how we're going to do it. I spoke about how I went to Botswana and I was told to put together all these women, like women I had never seen. And I started going on Facebook to look for people to come to this event. And before I knew it, through other survivors, I had over 60, 70 survivors that came. And it was just amazing, to meet these women and be with them and listen to their stories. And when they left there, most of them went back and they started doing amazing things. So we've got a chat now where they come back and tell you what they are doing. And it's just amazing. So all we need to do is just give them a voice, give them the space, and give them the support that they need. And you will get the elimination done in no time.
It's the domino effect.
Absolutely.
Mhm.
Well, thank you both so much for sharing your stories today. I think one thing I have learned from both of you is that your stories matter, and they have been so important for me to learn today, and I really appreciate your time. And with that, this concludes our webinar for today. So thank you again, Tamika and Karen. This was just such an incredible event. And the recording of this session will be made available on our website, along with PDF copies of the slides that you both shared. And I just look forward to learning more from both of you and working with both of you. And I hope that everyone has a great rest of their day. So thank you all.
Thank you and bye.
Thank you so
Bye.
much.